I think that we're, going into 2026 with an outbreak that is still hot. I don't think it's slowing down. And I think that whenever you see an outbreak in one state, infections don't heed borders. And so I think that folks that are under vaccinated for measles will be at risk for measles, and that may mean a much larger outbreak.
My concern now is that we contain it. That's what we're trying to do now. And so I partnered with the South Carolina Department of Public Health to bring out these mobile vaccination units to see if we can get people vaccinated.
It's going to find the pockets that have a high population of unvaccinated individuals, and it's going to spread really quickly and really rapidly in those places. So I think especially the states closest to, South Carolina right now, but really everyone, it's because people are getting on planes or getting on cruise ships or doing things, like it's really important to make sure you're up to date on your MMR, make sure your kids are, because it could spread everywhere.
We're still having some challenges in terms of cooperation from people who would come and get the vaccinations. And quite frankly, I don't know what it's going to take. But I mean, at the rate that it's going, we're going to continue infecting people.
I like to go down those rabbit holes, and it opens up millions of questions, like what's in the vaccines, why are we giving all these vaccines, and when she was born, I was thinking about like maybe not vaccinating her. I vaccinated my other two, but maybe I won't do her.
Thank you very much.
Thank you.
It's not bad to make the choice to vaccinate against things that we haven't seen in 20 plus years. And, one of the things I always say is talk to somebody who's over 70, talk to a grandparent, great-grandparent, and ask them what they think about vaccines. They were lining up to get shots.
I think questioning, asking questions, that is healthy, that is good. But when things get politicized, people get dug in, and you just don't listen to reason from either side. And so I think that's what happened with COVID, and it's just created these camps that then become immovable because the person I voted for says this, or the person I voted for says this, and it's one of the hard things in our country in general right now is just how divided everything is, and the fact that this has been thrown into that is difficult because there's so many years and so much data of why this is okay.
To respond, we have rhetoric that's coming from the secretary and others in leadership at CDC that cast doubt around vaccine and its ability to prevent infection as well as its safety. And so the vaccine has been demonstrated for decades to have a risk-benefit ratio that makes a lot of sense. It is, no vaccine is free of side effects, but the side effects of the MMR are pretty minimal. And so ultimately, when you have leaders that are touting snake oil, frankly, so untraditional mechanisms of treating or preventing measles as opposed to the vaccine that is 97% effective, the best vaccine we know of to prevent an infection. It almost doesn't matter how good the response is because they're unplugging the integrity of public health.